Good afternoon and welcome to the Multicultural Media Online Conference brought to you by the Ministry of Health, Multicultural Health Communication Service with the support of Multicultural New South Wales. I'm Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service, and we welcome you here today. And we're so glad that you've joined us again after a few weeks, and we're so happy to have so many guests with us today to celebrate Multicultural Health Week. Yes, it's Multicultural Health Week, September 4 to September 10. We have, of course, with us our Senior Medical Advisor, Dr. Fizzell, with us to talk about COVID and public health. Thank you, Jan, for joining us again. It's good to have you.
Lovely to be here, Jess.
Thanks, Dr. Jan. And we have with us the Director of Multicultural Health Communication Service, Ms. Lisa Woodland. She is also the Director of Health Equity Prevention and Promotion of Southeastern Sydney Local Health District. Lisa, nice to see you here.
Yeah, thank you for having me.
Thank you, Lisa. And we also have from Tungabi and also Western Sydney, who's joined us to talk about the community and her work, as Dr. Shanthini Seelan. She is also a general practitioner and a dancer, and we'll find out more because this week is Celebrate Culture Through Movement. Every move counts. So we'll talk about that later. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past and present and emerging, and also Aboriginal colleagues and community members who may be joining us from this session today. We also pay respects to leaders and multicultural communities who are represented in this session. Now we'll start with the discussion. Dr. Jan, how is COVID? It's September, it's springtime. How's the condition? How's the situation?
And we've got some good news with COVID activity stable at relatively low levels, influenza activity further declining, RSV, respiratory syncytial virus, also stable. Now winter's over though. We won't be talking about COVID quite so much. We'll keep talking about important public health messages, but I think it's important that, we look at the global response to health and not just, acute respiratory infections. Having said that, though, we do know that people will still get unwell, and it's still important for them to take care of themselves and also keep other people. I know that, just amongst my own team here at work today, somebody's gone home, they've got a cold, they said, yep, don't want to give it to anyone else. So it's still important that we keep up those protective behaviours, because summer colds are not fun. And for people who may not have had their flu vaccine yet, who are planning to travel to the Northern Hemisphere, not a bad idea to still talk to your GP, talk to your chemist about that flu vaccination. And for some people, ATAGI have given us new information about boosters for COVID-19, particularly older people. So again, if you're looking to think, am I up to date with my COVID vaccination, talk to your GP. They'll have that new information. They'll be able to help you understand whether you need it or not. One of the key things, though, is making sure we stay safe. So stay up to date with your vaccinations, stay home if you've got those cold or flu symptoms, wear a mask if you're going somewhere where somebody is likely to suffer badly if they do get colds or flu from you. Talk to your doctor, make a plan so that even as summer goes on, make sure that you've still got a plan for what to do if you do get sick, whether you need for flu antivirals or COVID antivirals, or whether you just have other diseases that may need special management. And again, if you are unwell, please stay home, keep your germs to yourself, and particularly don't visit anyone who could have a poor outcome if you give them COVID-19, like a relative in an aged care facility or somebody who lives in a disability group home, for example.
Thank you so much, Dr. Jan. And as you said, if you're traveling, it's important to just make sure that you remember those rules or habits that we've learned.
Absolutely. And again, making sure that your other vaccinations are up to date before you travel as well. We've seen measles outbreaks in places like Bali and Indonesia, and there's other diseases around the world. So talking to your GP or your pharmacist before you travel to make sure that you're as protected as you can be before you head overseas so that you can enjoy your holiday or time with family and friends.
And also we need to remember that because celebrations like Multicultural Health Week is when we do get together. Lisa, Multicultural Health Week is a week that it's very special to communities. Tell us more about the theme and why it's important for us to remember physical activity.
Well, this year's theme, as you know, is celebrating culture through movement. Every move counts. And we're really highlighting the importance of physical activity for culturally and linguistically diverse communities. And the reason that this is so important is that we know that, particularly in some communities, there is actually low levels of physical activity. And, you know, there are lots of very, sound reasons for that, which we understand. For some people, you know, there's a focus on settlement issues, housing, employment, study, and they're really important things. But what we do know is that health is the foundation that enables all of those other things to happen, and that we can really try and sort of overcome cultural barriers and language barriers by really encouraging each other to be physically active. Being physically active is actually fundamental to good health. The other thing I think that's really important for us to remember is, as a community, we need to provide spaces that are safe and that are inclusive, so that we can, you know, go to the local park, walk around the local streets, do physical activity in areas that are low cost, where we can engage with family, engage with friends, and really celebrate our culture through a whole range of things that might be enjoyable to us.
Thank you, Lisa. And we want to show a video that is called Celebrate Culture Through Movement, and so that you can see just how many ways you can celebrate movement. So we'll watch this. It's never too late to start moving, Dr. Shanthini. That's right. I understand that aside from telling people to move, you're also moving yourself. How important is it for people to remember that it's not about being rigorous, and it could just start with one movement or one action?
Well, moving your body makes you feel more energetic, and it improves your mental and physical well-being. And we do know that you can actually prevent chronic disease, and diseases like heart disease, diabetes, and even dementia can be prevented. And and we also know that even certain types of cancer can be prevented by being active. It can also have, and also being active also improves your social life. You can do a lot of active, becoming more active, and doing it with your friends and family will improve your activities. Your social life will become more active, and you can have things to do with your active. Can you cut?
Yeah. Family. Yeah. Look, there's a photo of you with other doctors that we'd like to show, and it shows that culture and movement is important, right? There you are. And that photo is with a lot of the other GPs. Is that correct? So and so it's practice. You practice what you preach, isn't it?
I practice what I preach, because being multicultural, like we come from different ethnic backgrounds, and we have ready-made cultures where we can actually delve into, and we can bring it and come forth with it, and we can actually go deep into our cultures and bring all what we are born with and bring it out. And I'm not a traditional dancer. I never learned to dance, but it's there. And if you have some interest, go out, bring it out, and learn it. You don't have to be shy or be scared. Just go and find something there to do. Learning to dance is like taking a mini vacation from your stress. go ahead and do it. It's really fun. And you do it with friends. I have this group of some fabulous female friends that I have, and we meet once a week and you spend an hour doing this. And I'm telling you, it's so much fun. And last Sunday, we had this fantastic event where we put on this show and we performed this dance. And I had to do it with a whole range of with this group of people, which range from 5-year-olds to young kids, to teenagers, to young adults. And our audience were family and friends, and they cheered and clapped and whistled at us. And I've never had so much fun. It was amazing. And I'm still on a high with that. And it gave me so much self-confidence and self-esteem. And I felt that I was on top of the world. Oh, well, still reeling from that.
Well, we will try to do that as well. And at least we know that our GPs are dancing with the dancing GPs. It's really nice.
I call dancing GPs, yes.
The dancing GPs. Dr. Jan, there's data that says that it is important to that physical activity within multicultural communities could be lower, but because of a range of other factors.
Absolutely. And we know that people from non-English speaking backgrounds are less likely to report in our population health surveys that they're doing the same amount of physical activity and exercise as people born in Australia. And there are lots of barriers. For example, if you've got exercise classes in English and English is not your first language, the cost, people often think that if I'm going to do something, I've got to go and join a gym, I've got to pay for dance classes, but there are a lot of low cost activities or free activities out there. And I think part of the hard part is also getting to some of the activities if you're trying to find a particular activity in a particular place. But what we've really saw that people are very good during the pandemic at getting together online, and that saves all of those transport costs so that people can actually still be together and still learn new things and do things. There's huge amounts of information on just about anything you want to learn on the internet now. It is amazing. And then once you've got some of those basic things, then, take the effort. But also the fact that, it doesn't cost anything to go for a walk. It doesn't cost anything to go and play with your kids in the park. It's hard sometimes to find that energy, especially if you've worked a long day. That's my constant excuse. I've worked a very long day. I'm really tired. I don't want to do it. But sometimes just that step of getting out the door and getting to that situation where you're doing it, you find that you're actually having a lot of fun and really enjoying yourself. And so giving yourself that permission to go, yep, I'm tired, but I'm going to do it anyway, is something to conquer, but it's certainly something that's very, very worthwhile.
Thank you, Dr. Jan. And that's why the Multicultural Health Week theme this year is really important. If you have any questions, please put them on the chat. If you've seen there's some resources or some information that could help you get active. But Lisa, there are a lot of resources that's been developed in multiple languages for this week.
There are. And look, when we were developing the resources, we really wanted to promote that physical activity can be fun, it can be engaging. It doesn't need to be high cost, high involvement. You don't have to be the expert in anything. You don't have to be the perfect dancer or, the champion of something. It's just about moving. And so the resources that we've created, tried to make them very positive, very inclusive, and really highlight the benefits of physical activity, not just for physical health and preventing the chronic diseases, including cancer that were mentioned, but also for your mental health. And one of my observations from COVID and the pandemic was, there was a time when all we could really do was have a walk in our local area. And one of the things that I loved was going to the local park with my daughter and just walking around and seeing lots of other people walking around as well. And it was just a wonderful way to connect and talk and walk together. And I think that we have to really encourage that sort of involvement across the generations as well. This week I've been involved in lots of conversations, and particularly for older people in, from multicultural backgrounds, we often want to look after them, take care of them, recognise that sometimes they've had a long journey, a hard journey. And we think that we're looking after them by giving them a rest. But really, the best way we can look after them is encourage them to get moving, come with us. If we're having those big family celebrations, have a walk in between the courses. That's good for everybody. So I think they're the sorts of things that we want to promote through our resources.
Yeah, that's correct, Dr. Shanthini. That is correct, right? Sometimes we try to protect our family members, and but yet it is by protecting them, you actually should be encouraging them to move more.
Exactly. Yeah, you shouldn't over mollycoddle them. You should actually get them out, because if you do too many things for them, then you're not actually letting them come out of their shell. You are actually doing too much to them, and you're not helping them at all. So they need to actually come out of their shell. They need to actually become more active, and you're actually getting them to live their life better. It is in the I would say the multicultural or the migrant community, when they come out here, physical activity is way down low of the priority. Unfortunately, they have got so many other things that they need to focus on. And so physical activity is right down. And I find that in my day-to-day practice, when I try to tell them about physical activity, it's a sort of an alien concept for them. And part and parcel of my daily prescription is exercise, which is really a very unusual sort of prescription for them. And it's really important that exercise is part of a prescription for them, because it's a lifestyle. When you talk about lifestyle management, exercise is really important. And for them, and when I talk about exercise, it's always the gym. It is not a membership to the gym is not the exercise that they need to do. There's various other ways they can do exercise. They can going to the park, walking their dog, going to the park, joining a Zumba class, taking their children to the park, cycling. But a lot of people think they have to go to the gym. Yeah. And most of the time that is, unfortunately, it'll only last maybe 1 or 2 months or 3 months. And after that, it is going to be impossible for them to go to the gym on a regular basis. And I will finally get a request, please give me a letter saying that I cannot go to the gym because I've hurt my back, because it's impossible for them to continue to go to the gym, and they'll be paying for a gym membership. That's what's going to happen.
Yeah, yeah, that's true, and it happens all the time. Dr. Jan, in terms of New South Wales Health and what the Centre for Population Health and Ministry of Health is doing, especially for parents and encouraging them to get their kids active as well as the seniors, as well as everyone, intergenerational activities, isn't it?
Yeah, and I think one of the key things is if you're stuck for ideas, depending on the age group. So we have the Step On program for seniors that helps older people. We have the Get Healthy coaching service, which is also available in Mandarin, so that people can take advantage of having health coaches who will help them through things, and there are translators available to help you access those services. Also, the Go for Fun program that helps get your kids active and also involves your parents. But generally speaking, you don't even need a program. It's really about the fact that you can just it's hard. You do just need to make a commitment to yourself and to your family that you're going to look after yourself and start moving. And I know how hard it is, but that's something that coming out of COVID, I'd lost a lot of my ability to do stuff simply because I was working and sleeping, and that was all I did for 3 years. And that's a long time to not do a lot of physical activity. And so the things I've been able to do this year, engage with my health professionals, and they've sort of been encouraging me. And if I disappear, they call me and say, Jan, where are you? Told my family and friends that this was my goal for this year. So they've made space for me to do these things, so that if I want to do something, they're supporting me in giving me the time to do it and understanding that, and then looking for things that I enjoy doing, so that they're things that I can build into my day. And, it's really interesting for this year. The first thing I did was actually start monitoring what I was doing and what were the things that actually increased my activity. And it's really interesting. It's things like when I go for a walk at lunchtime and I go a bit further to find lunch, or just go for a walk at lunchtime. Or it's when I volunteer with the Cub Scouts, and you wouldn't think that was a particularly, you wouldn't have think, oh, that's physical. But, somehow I get 10,000 steps in an hour and a half running around after the Cub Scouts. So it's really about, it doesn't have to be a formal gym program. It's all about what works for you, what do you enjoy doing, and what works for your lifestyle, but also activating your family and your friends to help you. Much earlier in my life, I took up Scottish country dancing because I had become really isolated with a young child. And again, my husband took my son for that time, and I went dancing. And that was my exercise, that I did twice a week, and learnt how to do a new thing, met different people from all walks of life, all backgrounds. And it was just a fabulous way, and it improved my mental health dramatically because I've been suffering from postpartum depression. So just, that support from your family is also important. And so telling your family, I'd like us to go, let's go for a walk, and having everyone motivated together. Let's go for the walk. Okay, we're going to the park and we're going to kick the ball.
Yeah, and you have to start that, right? It's free will. Now, I also started Zumba recently, the Bollywood Zumba, and I think and I'm dancing, going to home and saying, hey, I've been, but it actually elevates your spirit. You have been, it's a Sunday, and you've been with other ladies who've been dancing around, and I guess it does give you that mental wellness. I think that's it. Now, I just wanted to ask everyone who's on the call and who's online, please write down your physical activity. What's your favorite thing that keeps you moving and celebrate culture? So I expect you to write them on the chat, and so that we can see them. But talking about mental health, being a psychiatrist, Lisa, this is really important. Physical activity, as Dr. Shanthini said, it is medicine. It is like a drug that could help you. Yeah.
I'm actually a psychologist by training, so I don't want to take too much credit for my training. But look, that's one of the things that, is so important for me in relation to physical activity, is those mental health and well-being benefits. And we know that, it's great in terms of prevention of illnesses such as depression. And we also know that it is very helpful in managing illnesses like depression, along with other chronic diseases. And I guess the thing that resonated for me in what Jan was saying is that often there are times in our life when we lose momentum, and when we're ill, when we're injured, or when we age. And when we lose momentum, then it is hard to get back to it. And that's where we need the encouragement of family and friends and our social networks, because that momentum builds momentum. And it really does make a very, very big difference to people's mental well-being as well as their physical health.
And the resources for Multicultural Health Week actually just showcase that it's just simple steps. The first step is just to think about it and get started. Like Dr. Jan said, it is just starting a plan.
And I think that what we also know, which is very encouraging, is it's for people who are relatively inactive, where the greatest benefits are. So if you're having a sedentary lifestyle and you start moving, those benefits are going to be enormous for you.
Dr. Shanthini, with the community, I mean, a lot of the communities, they have traditional games, and they have traditional games that's come from back home that they can start doing, and it just encourages celebrating the culture, isn't it? So is that something that would be recommended for the community and members of the public?
Yeah, most definitely. And these games are played in their native villages, and they have been there for centuries old, and they can actually be recreated. And I'm of the subcontinent background, and we have celebrations all year round. And I like to say that coming over the next few months from the subcontinent, there are celebrations, there are festivals coming over the next few months that are coming up, and a lot of things are happening. And people are going to be celebrating things. So why not come in and get involved in all these games and things that are happening? So all these are coming back into, coming back into vogue again. So there are games and participation and in these particular kind of activities are there. So it is fine to to take part in all these, and it is fun, it is active, and it is good for people to come in and take part and be more become more participating in them, and because all these things are there for them to take part in, and it is good for them to get involved in their cultures back again. So it is not it is there, and it is for them to, if they can not forget their roots, it is, and like I said, it every move that counts, every move that counts.
And I think also learning new traditions, learning like Scottish dancing.
Absolutely. And, you know, I don't know if my great-grandfather ever did any Scottish dancing whatsoever, but it was a way of connecting to a heritage that is from long ago. And again, my son is a dragon boat racer, and there's a huge amount of tradition around longboat racing throughout Southeast Asia. In different countries have got lions or elephants or dragons as their longboats, and understanding that and being part of that culture is a huge privilege, as well as being a really exciting sport. Anyone who's been down at Darling Harbour at the Lunar New Year will know. And it's one of those sports that, you know, anyone from 12 to over 60, 70, 80 plus is paddling and out there and doing things. And so there's so many amazing things, and it might not be of your culture, but learning about other people's cultures while participating in activities respectfully is just a fabulous thing to be able to do as well.
Yeah, and I guess it's also important because there are intergenerational, you know, their families, their carers, and there's also people who have disability and in families. And I think it's just as you said, Lisa, it's about engaging everyone to take part.
Yeah. And I think it's finding simple things to do together where everybody can participate, and it doesn't matter what level of skill you have. It's just about getting involved. And all activities can be modified to include young children, older people, people with disability. You know, there's no barriers as long as we're creative and as long as we're motivating ourselves and each other to be involved.
I'm seeing here that here's this comment from Saini Afiaki. We from the Pacific certainly have varieties of traditional dances, sports, and creative activities from all different islands, some movements more robust than others, and agreed to revive these traditional activities with a health focus also, rather than only for celebration, which is right. Everything we do is health related.
I think the thing is that we can be celebrating, and our health is our secondary thing that happens, but isn't it wonderful that that's what happens? And I think that's the thing, that you don't have to be super more strenuous or super anything else, but just that beginning to get moving, staying in touch with people as part of our mental health, so important.
And with mental health, there are support services like Transcultural Mental Health, again, a service that you could ask for support in language. And Lisa, with services like that for communities, how important is it that language services and information is provided for communities?
Oh, look, I think that we know that language is one of the main barriers for a lot of people, particularly newly people who are newly arrived to Australia, to participating in physical activity, but also to linking into our health services and the supports that we have around us. So providing in-language services, providing translated information, it's just a very respectful way for us to be inclusive as a community so that we can all enjoy the benefits, of the services that are offered and the opportunities that are offered.
Thank you. And Dr. Jan, you were saying talk to your GP, and we have a GP right here who's just that you work with communities, and that those resources that are provided to communities actually are used.
Yes, most definitely. In my practice, we have most of us have of Sri Lankan background, and I have a colleague who is one of the very few Afghani doctors. practicing in Sydney. So we have a massive group of people from Sri Lankan and Afghani background. So it's very useful when you have doctors who belong to your culture, because we have what we call lived experience. So we see a lot of people of refugee background. So our clientele have a lot on their plate when they come to see us. So we see a lot of people with a lot of PTSD kind of background. So it is not a very easy population to deal with. So we don't see the usual mainstream Australian public. We see a very highly complicated, complex kind of people with kind of a lot of complex complication patients. But it's very rewarding experience to see them and to help them. And they come with a lot of complicated physical and mental health issues. But at the end of it, we feel that we do our best for them, and we love what we do.
And the resources really do help, the resources
Yes,
that help,
the resources really
that
help.
we provided, and simple resources that have simple messages.
Exactly.
Yeah.
We are called the most successful multicultural nation on the planet, aren't we?
Yes, that's right. You heard that here, and it's true.
Sure.
And I think one of the things that really is important, that we have a Multicultural Health Week in New South Wales that celebrates the health of culturally, linguistically diverse communities. And from a New South Wales health perspective, as a medical advisor, Dr. Jen, how inspiring that is for communities.
Look, I think it's so important that people recognize that we recognize their culture, that we recognize their background, and that we want to work with them, understanding that not everyone has the same lived experiences, and that we need to be respectful of people's different lived experiences, but also celebrate a lot of their experience, because, oh my goodness, how much do we learn and how much do we gain by sharing together what we're doing and making sure that, respectfully, we can enjoy each other's cultures. And really, it's a wonderful thing to have grown up in Sydney, and to have experienced so many different places without actually having to leave Sydney. It's really interesting. You go overseas and, you can feel at home. I've been to China, been to Sri Lanka, been to, just recently in Thailand. And, we're familiar with the different foods of different cultures, but we're also familiar with some of the different ways of being polite, different things that are important to different people in culture. And so that we can be respectful in our engagement with different people from different backgrounds and, truly celebrate culture. And again, learn different ways of dance, different ways of moving, Zumba, dragon boating, whatever it is. There's different ways that we can engage across culture and learn different things and, celebrate that.
Well, we've run out of time, and we thank you for sharing all your activities online with us and in the chat. So we'll look at that. But thank you for being with us today. I want to ask Lisa, any last words that you'd like to share with the community and the media online?
Look, it speaks for itself. Physical activity is so important to our health. Health is so important to our lives. So just really encourage people to move more, and that, every move counts.
Thank you, Lisa. Dr. Shanthini.
Yeah, and that was such a beautiful thing you said, Jan. I loved it. Thank you. And thank you so much for having me today.
Well, thank you. And we hope to see, we'll go watch your dancing and the dancing GPs one of these days. And congratulations on your event for that. So thank you so much for being here, Dr. Shanthini. Jan, any last words?
Well, as Lisa has said, and as Dr. Shanthini has said, every move counts. So just start. That's the hardest part. Start. And even if you don't succeed, you don't set yourself something unachievable. Even if it's just 5 minutes of gentle movement each day, and just building that in quietly, gradually, and getting people around you to support you. 5 minutes easily becomes 10 minutes. 10 minutes can easily become more, but you need to start. So every move counts. So start, and, we'll keep encouraging each other.
Thank you so much, Dr. Jan, Dr. Shanthini, and Lisa for joining us today. And thank you for being with us and celebrating Multicultural Health Week with us, celebrating culture through movement. Every move counts. It's never too late to get active and start moving. Have a great afternoon, and we'll see you walking out there next time. We'll see you again in 2 weeks' time. Bye.